Good afternoon, everyone, and thank you for coming out to Pennington. For me, at least, it's a very exciting day, but I think it's an exciting day for a lot of folks in Louisiana. And while we still have a very long way to go to put this pandemic behind us, we know that it's only going to happen once enough of us receive the vaccine. And that's what we're here to talk about today. And I know that a lot of Louisianans are going to benefit from receiving their COVID-19 vaccine right here at this facility. So I want to start by thanking Our Lady of the Lake, the FMOL, and Pennington for their partnership and their efforts to make the vaccine more accessible to the public at this community vaccination site. To date, we have administered more than 500,000 doses of the vaccine across Louisiana. And quite simply put, it wouldn't be possible without our partners, hospitals, clinics, higher education institutions, pharmacies, and a lot of other partners as well. And I'm very thankful for them, and I know that they are as dedicated as I am to ending this pandemic. Also, and this is an interesting milestone for me, as of today, we can say there are more people who've received vaccine in Louisiana that have been tested positive for COVID-19. So there's lots of different metrics to try to measure your progress, but that's one that I think is meaningful. This week, as you know, we officially lowered the vaccine eligibility age to 65, and we also included a few other smaller groups as well, including the Unified Command Group, which is why I am here today to get my vaccine. That's why the Secretary of State, Kyle Ardwan, is here to get vaccine today. But also we added some state frontline COVID responders and also some election workers for the March and April elections that'll be coming up shortly. So with all of the groups that are in the orders of priority that can currently receive vaccine, that's about 1.2 million Louisianans. So this is progress, but as I mentioned, we know we still have a long way to go. I have been looking forward to this day for some time. I knew that when we started back in December that I was going to wait my turn until my priority group got here, which is kind of strange because I'm in charge of deciding what the priority groups are. But I knew that we needed to get to some frontline essential workers, first responder types who are not in the medical field, but responding to the COVID emergency, and then get to the Unified Command Group. And that's why we're here today. And I've got several other members of the Unified Command Group that are here that I'll mention in just a moment. And for me, quite frankly, waiting hasn't been easy. And so I know that it's not easy for anybody out there who wants the vaccine. We have an awful lot of folks. The demand exceeds supply. The good news is supply is getting better every week right now, not in huge numbers, but this week, for example, 20% more than previous weeks. Next week, we know we'll have a little bump again as well in terms of the vaccine doses that will be available. So our goal is to have everyone vaccinated, and we're going to continue adding priority groups as we are able. And there's just one analogy that I like to talk about because I think it sort of makes it clear. If you have a funnel and the bottom of the funnel is only, so wide, you can put all the folks in the top, all the priority you want. It's not going to come out any faster. And what you're going to do is create a lot more frustration if you do that. And quite frankly, the other part of this is, if you prioritize everybody, you really don't prioritize anybody. And we're going to do everything we can to make sure that we address first and foremost hospital capacity, making sure we're preserving that, but also saving lives. For those who are eligible and may continue to have questions about whether they should get the vaccine, I want to encourage you. I have every confidence that the Food and Drug Administration would not have granted the emergency use authorization had these vaccines not been safe and effective. I know that the CDC would not have ratified that had these drugs not been safe and effective. And so I encourage everyone to be vaccinated when you're able to do that. And I'm proud to stand here today alongside Secretary of State Kyle Ordwin. We've got DOTD Secretary Dr. Sean Wilson here with us today, Louisiana Workforce Secretary Ava Dajwa, and DCFS Secretary Marquita Walters, all UCG members who will be receiving a vaccine. At this time, I'm going to turn it over to John Kerwin, who's the Executive Director of the Pennington Biomedical Center. He's going to be followed by Richard Bath, the President and CEO of the Franciscan Missionaries of Our Lady Health System, and then Secretary Kyle Ordwin is going to speak to you all. I'll come back at the end of those remarks and I'll have one more announcement, and then we'll take a few questions and then get vaccinated. John?
Thank you, Governor Edwards, Dr. Vath, speakers, guests. It is my distinct honor to welcome you all to Pennington today to mark a historic moment in our fight to overcome a coronavirus that has wrought much grief and havoc on our community, our state, and our nation. Today, however, is a day of hope. It's a day that is notable because it demonstrates how we are so much better when we work together. What we have here is the combination of strengths, unique strengths in science from Pennington, in healthcare from Our Lady of the Lake and FMOL, and governance from the governor. We've created a critical resource for our community. The COVID vaccination super site is uniquely positioned to provide easy and quick access to thousands of our citizens. We have successfully created a clinic that has the capacity, I emphasize the capacity, to vaccinate more than 7,000 patients a week. Our capacity will only be limited by our supply. Now, I have no doubt we're all living in historical times and we're witnessing one of the greatest accomplishments of scientific history. The first genetic sequencing of the novel coronavirus was made in January 10th of last year. This work led to the production of several vaccines that have been shown to be highly effective against the virus. 3 of those are available to us today through Moderna, Pfizer, and AstraZeneca. So if we had to have a deadly pandemic, this was a good time for it to arrive. The application of information technology to biology has allowed the world to react to the threat with the speed that we need to overcome what is indeed a massive viral threat to humanity. So that said, I think one of the things that is particularly notable is that the technology that was used to develop these vaccines was developed using university intellectual property and expertise, not unlike the kind of IP and expertise that exists here at Pennington. But now that we've created the vaccine, or now that science has created the vaccine, our challenge as a community, as a state, and as a nation is to administer this vaccine to our citizens expeditiously and equitably, and as quickly as possible. The community COVID vaccination site that we're opening here today, we feel will do just that. There's a couple of other things I'd like to highlight from a COVID perspective, from Pennington perspective, and I would like to say thank you to the governor, when we have him here today, for his support for an initiative that led to the funding of an NIH grant to conduct COVID testing in African American communities here in Baton Rouge. This is a $1.8 million initiative that would provide free SARS-CoV-2 testing to the Black community. This is a partnership with the Mayor's Healthy Initiative in Baton Rouge, and it is funded by NIH. Now, we're all challenged by testing, and the need for testing continues to be essential as we seek to overcome the COVID mutations that are emerging, particularly the more transmissible UK B117 variant, and you've heard about the more resistant South African B1351 and Brazilian variants. We have here at Pennington the capacity to sequence the virus and to be able to provide the data that's needed to identify those variants in the communities that we're testing. And we are offering that service to the state in the fight against COVID. So I'd like to conclude by thanking everybody who has made this clinic possible for your ongoing commitment to the COVID battle. Just know that Pennington will always stand ready, willing, and able to partner with you in order to ensure the health of all the citizens of our community and our state. Thank you, and I would like to hand off to our partner, Dr. Richard Fath from FMOL Health System.
Well, thanks, John, and thank you, Governor. First of all, I have the pleasure and privilege of being the president and CEO of FMOL-HS, and that's really the parent company that includes Our Lady of the Lake and all of its clinics and all of its sites. We also have other institutions. We have 9 facilities around Louisiana and Mississippi. I think I want to start by actually thanking the general public. One of the things about being in healthcare and being a healthcare provider is we have been very, very blessed by all of the gracious thanks and gratitude that have come from the public. We see it every day on the news. We see it in the newspaper. That has been very, very important for us. And I will tell you, as a pulmonary critical care physician for 23 years before I actually got into administration, that means a lot. That means a whole lot to caregivers. So really thanks to the community for that. That's extremely important for us, and we really relish that. So I think it's now time for us to offer some thanks back, and that's really what the vaccination is really all about. You know, back in December, when it was clear that we would get some vaccines available and started to spread around the country, we began to talk about how we would organize our thought process and our processes around delivering vaccines to as many people as we could. And I made the comment that from a health system perspective, vaccination for coronavirus is clearly the #1 initiative for us in 2021, without a doubt. We'll continue to do the excellent work that we do in caring for people who are desperately sick in our hospitals and in our clinics, but this was going to be a big focus for us. And so we've taken that challenge, and what we did, knowing that we fully anticipated that post-Christmas and New Year's, we couldn't have the hospital folks all also be focused on vaccinating the community. So we engaged our Franciscan health physicians, our employed physician group. We're the second largest group in the state of Louisiana to try to take over the community vaccination for the community patients and all of those individuals who would fit the demand and the next stages and phases of vaccine distribution. So they've really done a great job. You know, the governor has already said this. As a clinician, there's no doubt that the vaccines are safe. We've looked at this ad nauseum, and you hear many stories that come out all the time about some side effects. We expect side effects. But, you know, in the 35,000 doses or so that we've given within FMOL-HS, we've not had any serious side effects. Many of us have taken the vaccines, and so we really do encourage people to take the vaccines. So really at this point, in, I guess, late December and early January, we started giving vaccines, initially to our healthcare workers, but it was critical that in early January, we opened up a couple of sites that were important to us. We opened a site in North Baton Rouge on Airline Highway where we have our ER, we have our urgent care center, and we have a clinic. We also opened a site in Ascension Parish. We continue to have those, and we will continue to keep those sites open because they're important communities for us, and I think for the Baton Rouge community at large. We're excited about this opportunity with Dr. Kerwin and the Pennington Biomedical Research Institute to be able to provide the individuals to deliver the vaccine in this site. This is a wonderful site. It's large, it's beautifully laid out, so we're excited about this, and we do hope to exceed 7,000, maybe 7,500 or more vaccines a week. So I think this is really key for us. I do want to offer a special thanks to a number of folks. First of all, Dr. Phillips and the Louisiana Department of Health, because they've been very instrumental not only in guiding us, but in working with us to make sure that we could do the fine work that we do. Also, I would like to actually thank the Office of Public Health and Dr. Cantor because of his guidance and all of the work that he has done for us. That's been very helpful. And a huge thanks for Dr. Kerwin and the partnership that we've created with Pennington. We have a long-standing relationship with Pennington, And the fact that we were able to collaborate on this and be able to provide this for this community, I think, is extremely important. And lastly, of course, to Governor Edwards. You know, I actually talked to a lot of CEOs of systems around the country, and Louisiana has done remarkably well when we compare ourselves to others, and I think that's due to his leadership and the leadership of all of those groups that we mentioned already. This has been critical, and I really thank all of the healthcare providers, all of our pharmacists, all of those people who have been part of this vaccination effort. That's important. So I will end with the saying that we use at FMOLHS: we're in it to win it. And we're going to look forward to being able to expand this community vaccination project to as far as we can take it. So thank you very much.
Well, thank you all for coming out today, and it's a gratitude fest, I believe. Thanking Our Lady of the Lake, FMOL, and the Pennington Center. I was just looking around the room, Governor, and the last time I was here, there was not a divider, and it was a couple years ago, and it was a fundraiser for our healthcare event. And now we're here talking about how to save the people in our great state. It's an honor to be here with so many heroes fighting on the front line against this deadly disease that has ravaged our state, our nation. I want to start by thanking all those frontline workers. We owe you a debt of gratitude. You are our heroes. I'd like to thank the governor for his leadership during this difficult time. I greatly appreciate his willingness to make election workers eligible for the vaccine. Because of their age, many election workers are already eligible for the COVID-19 vaccine, but those who have not yet crossed that age threshold are still vulnerable. Thanks to the governor, many election workers under the age of 65 will be eligible for this vaccine, greatly increasing their protection and giving us the ability to perform the election like we know we can. Election workers devote countless hours to helping deliver democracy to the voters of Louisiana, and we greatly appreciate their sacrifice and will do all we can to help keep them safe in the course of their duties. Election workers serve a critical purpose and do not receive nearly the credit that they deserve as the boots on the ground for our elections. Louisiana's election worker population mirrors the rest of the state, overwhelmingly elderly. My office continues to work to recruit the next generation of poll workers, and with this, it makes it even more possible to make certain that we're delivering democracy to the people of Louisiana. I want to thank the Secretary Phillips for her and her staff and the help that they've given us in order to make this a reality. These were difficult choices. The governor has done a phenomenal job in determining priorities. And in our numerous conversations about this issue, there was no doubt that there was a lot of discussion, a lot of soul searching that goes into prioritizing different populations in order to have this vaccine. But I think it's important, and he saw the importance of this, and I truly thank him for doing this, because it's not I can't imagine his job. I know my job is difficult enough in times like this, post-election and prior to the election, but the fact of the matter is he's bearing the brunt of this for our great state, and I appreciate all of his efforts and those of his staff and those of his cabinet members, and of course everyone in Unified Command Group, of which I serve. We've had a lot to deal with in the last year, and we have more to come, but the light is around the corner. We're beginning to see the options that we have in order to move forward and to be safe. Again, mask is important, and vaccinations lead us to the solution that we need. I urge all of my friends, family, and the people of Louisiana to use this opportunity to get the vaccine. I believe it's safe. We all know that any medication has some side effects, but the reality is without it, we can't survive it. So God bless our great state. God bless the people of Louisiana. God bless our healthcare workers. And God, we certainly thank those who work so hard to bring us the vaccine. Thank you, God.
Thank you, Kyle, and John and Richard. Before we conclude, I did want to give you today's numbers and then make an announcement about the proclamation that expires tomorrow. Today, we report 1,321 new cases on 33,236 new tests. Very sadly, we're reporting 20 additional deaths today, and the total number of deaths is 9,162 in Louisiana since the start of the pandemic. Hospitalizations are at 1,122. That is down 22 from yesterday. And mechanical ventilator usage is up by 2, and we currently have 151 patients across the state on ventilators. Yesterday, as I always do in advance of the expiration of proclamation, we went through the gating criteria with the folks at LDH and the Office of Public Health, and I do have Dr. Joe Cantor with me today if you have questions in just a moment that need to be addressed to him. We were able to go through the gating criteria yesterday, and there has been some progress over the last month or so, and we're very, very thankful for that. The fact of the matter is, though, the baseline numbers remain very high and concerning. Those numbers are percent positive. Those tests that are administered that produce a positive result, but new cases, hospitalizations, we still have twice as many people, for example, with COVID in the hospital as we had over the summer, and then deaths. And then we are also really worried about something that was mentioned a few minutes ago, and that is the new UK variant, the B117 variant of the coronavirus that we know is in Louisiana and spreading. And best estimates now are that it's 50% more transmissible than the variant that is currently the dominant strain. And within the next month or so could easily be the predominant strain in Louisiana and elsewhere in the country. We also are seeing new evidence that the lethality of that particular strain may be 30% higher. And there's still a lot of research going into this, but there's still a lot to be concerned about. Every single one of our 64 parishes in Louisiana remains red for a high incidence of new cases, meaning there are more than 100 new cases per 100,000 population over the past 7 days. So with all of that in mind, and knowing that Fat Tuesday is Tuesday, and mindful of what Mardi Gras did to our state last year, and how widely and deeply the virus got seeded into our communities all across Louisiana, but principally in that greater New Orleans metropolitan area, I have decided to stay in the modified phase 2 with the current restrictions in place for 21 more days. And I will tell you that I am very hopeful that when we next announce a new proclamation, that we will be able to ease some restrictions if we continue on the path that we currently are on. So I encourage people to do your part. Be a good neighbor. Shouldn't be a lot of indoor gatherings, but if they are, they need to look like what's happening in this room right now, where 100% of the people, with the exception of the two of us at the moment, are wearing masks. And that is as important after you are vaccinated as it was before. And I know this can confuse people, but the vaccination is effective to prevent you from becoming sick. It is not guaranteed to prevent you from becoming infected or infectious. And so you can still spread the virus even though it won't make you sick. So now more than ever, being a good neighbor, especially for those who've been vaccinated, is worrying about your neighbor and not so much about yourself. So our conduct should not change in the foreseeable future. You know, I announced the other day that we had lost 1,000 people in the previous 3 weeks. We've got to get off of that trajectory, and deaths are a lagging indicator. And as case numbers go down, as hospitalization numbers go down, then we should start to see that show up in the death count as well. But we're in charge ultimately of what that looks like. And I'm just going to encourage everybody in Louisiana to do their part. So please be very smart and very courteous about how you act, and please wear your masks, distance, wash your hands frequently, stay home when you are sick, protect the vulnerable, and when you are able to do so, please get vaccinated. I will take a few questions, and maybe not as many as normal because we got some more work to do here. Greg, it's good to see you, stranger.
Thank you, Governor. Governor, how have you found that the weekly briefings of the White House have changed, or is it still the same infrastructure?
Yeah.
How is that different from what it was before?
They have changed a little bit. The good news is we are having weekly briefings. Quite frankly, they continue to be extremely important. I think the overwhelming majority of governors do participate. We had one earlier today, and I think almost all of the ones under the Trump administration were video telephone conferences. These are primarily telephone only, and they last 45 minutes to an hour, and governors are able to ask questions, and they brief things that are obviously very important to the states, and it is a two-way line of communication. They will give us some information. We tell them what our concerns are, and we've actually seen them address our concerns in some things. For example, the way the CDC reports the data. You know, I think it still has a ways to go, but if you were paying attention to Operation Warp Speed and the data it had, and CDC, and very confusing, and I think it simplified that. For example, we're able to talk through things like allocations, and it was our requests to them that gave us 3 weeks of visibility. So they told us today that we're going to have an increase next week, and told us what that's going to look like, and that our planning for the next 3 weeks will include a minimum of that number of doses going forward. And so that back and forth is very constructive, but they are different. You know, they're led by Mr. Zients, who is the White House COVID-19 task force leader, and then he has folks on from the CDC and other folks on as necessary. General Perna, who runs Operation Warp Speed, is a regular briefer as well at those meetings. But they've been very, very helpful. Yes, sir.
Governor, could you talk a little bit more about what exactly the White House told you in terms of the number of doses we're going to be getting next week and the subsequent 2 weeks? And also, have you made a commitment to Our Lady of the Lake and Pennington that you will have a certain number of doses available each week for this site to make sure people aren't going to be left, without?
The second one is no. We haven't made that commitment, although, again, it's helpful to know that for the next 3 weeks, we're going to have the same number of doses coming in at a minimum, and that does allow us to better plan, and then we can communicate and coordinate earlier. And the Office of Public Health works to make sure that the vaccine doses are going out in a way that best serves the people in terms of both efficiency and equity. And I can tell you this operation here will be a big part of that. But quite frankly, I refrain from using the word mass vaccination right now because I don't believe we're receiving the doses necessary to really do mass vaccination. But we are doing community vaccination sites. That's what this one will be. And then when we get enough doses allocated to us, and perhaps this will happen, and I mentioned this last week, I believe, when the next vaccine is approved, and that could be the Johnson & Johnson in the next few weeks. We don't know exactly when that's going to happen or what our initial allocation would be, but that is a single-dose vaccine, and the storage requirements are less onerous, if you will, with respect to cold storage. And so forth, and so that vaccine may be one that we employ in mass vaccination sites. Whether that particular vaccine comes here or not, we don't know yet. But we do know that sites like this one across the state are incredibly important for us to meet our goal. With respect to the exact information that we were given today, it was rather inexact, but we know that there will be an increase of 5% for next week. We don't know yet whether that's Moderna or Pfizer. The increases we had over the last 2 or 3 weeks have all been on the Moderna side. So we believe we have a, where's Joe? It's 5% for next week.
5%, don't know which one it is.
Yeah, but we don't know which one. We do know that there's a new initiative that started by the White House where they're going to pick a number of FQHCs around the country. I believe they're going to pick 250 of those, with at least one being in each state, in order to directly allocate vaccine to. It won't come off the state's allocation. We don't know yet how many in Louisiana, who they are, and so forth, but we know that there will be doses allocated in the first week for that effort. 500,000 will be first doses and 500,000 will be second doses. And over the next couple of days, we hope to gain better visibility because we're already using FQHCs as part of our overall effort. And so we welcome any initiative that brings additional doses in, gets them into the hands of enrolled providers who can put shots in arms. We just need the visibility on what that, especially when they come with their own doses and they don't come out of our allocation. We just need better visibility into that so that we can put our plan together around that. So that's what we know about next week at this point, and I think there will be some additional clarification over the next couple of days. Yes, sir.
Governor, until now, you've prioritized sending vaccines to pharmacies in local communities. Why was this the time to open up a community vaccine site?
Yeah.
Why shift in that direction?
Well, we've been doing this since the beginning, sending vaccine to hospitals. And so you get FMOL here partnering with Pennington. And initially we sent them to hospitals because the first order of priority were those hospital providers, and not just your nurses and doctors and therapists, but custodians and people in food service, everybody who worked at that setting. Ever since then, we have been sending doses every single week to our hospital partners across the state. That includes our biggest hospitals in the state, like Oxnard and Children's and FMOL and so forth, but it also includes our rural hospitals. So what this represents is just an evolution of what we've been currently doing so that people don't actually have to go to the hospital campus in order to get those doses administered going forward. They're going to do it here at Pennington. And of course, the size of this operation will depend upon the number of doses that they get. And I want to feed them as many doses as we can, but making sure that we're being equitable in our distribution and administration around the state. Yes, ma'am.
Governor, do y'all have, now that y'all have gone through as a state that all of the nursing homes, at least one passed, I think that was supposed to have happened as of this week.
Yeah.
Do you have any better numbers or updated numbers on what the uptick looks like from staff and from the residents at those facilities?
I'm going to ask Joe to come up because I think I know the answer, but in case I'm wrong, come on up, Joe.
Thanks, Governor. I wouldn't bet against that, though. It's about half or so have now received second visits, and the expectation is that more staff would receive the vaccine on the second visit, and that delta so far is 12%. So 26% of staff received the vaccine on the first visit to the nursing homes, and an additional 12% so far on what's happened for the second visits. So the running total, all told, is 38% of staff uptake. And again, that's with every nursing home having a first visit and about half having a second visit. The residents, we had about 69% take it on the first dose, and some additional ones, somewhere around 8 to 10%, took it additionally on the second pass as well.
Dr. Canner, one more
Yeah,
for you.
Sam.
We have equal numbers roughly of confirmed cases and people who have received one shot.
Not equal.
More on the vaccine side, sure.
That's right, Sam.
But I guess roughly speaking, we have 800, 900,000 people with some degree of immunity now. So I'm wondering at what point, and that doesn't count people who didn't test positive. At what point does this immunity start making a dent in cases and hospitalizations, and particularly as elderly people get the shot? At what point do we expect to see that having an impact, or do you think we're having an impact right now, and that's why we're seeing lower cases and hospitalizations?
The question for those that didn't hear is at what point do we think that the natural immunity that people get after a natural infection provides population-based benefit to us? And I don't think we're there yet. And that's frustrating because I wish that we were. It's just the facts on the ground don't argue that way. The course of this virus has been that it's been coming in waves, and clearly we had a wave over the Christmas and New Year's time with increased travel and increased gatherings. It was rather predictable. And now that's going down, just as it did during the summer wave. What we do know about natural infection is that it very likely provides some degree of incomplete protection for some degree of time thereafter. But to really specify how much protection and how long that lasts, the jury is still somewhat out. I mean, there's data coming in slowly, but it's not great data. And I'll tell you, we absolutely are seeing some people get infected a second time. And I've actually clinically now seen a couple people get infected a third time. What the CDC says is you likely have some degree of protection following a natural infection for about 90 days. But it's not all or nothing. It doesn't mean at 91 days it all goes away, and at 69 days or 89 days it's 100% protection. It's nothing like that. At some point it weans, and that's been the nature of this outbreak. Without question, there's benefit to people who had COVID already to get the vaccine when their time comes. Without question, there's benefit to that. It's possible that the amount of natural infection and now some degree of protection is providing some baseline level of protection in the community, but I would not take much solace in that. And to the real practical question about what's coming ahead, and the governor has alluded to this or said it directly in every press conference we've had the past month. The variant is circulating. The best estimate from the CDC now is that the B117 or the UK variant is doubling in numbers nationwide every 10 days. And we know it's here. We know it's here in much greater numbers than we're able to confirm just by virtue of how little genomic sequencing we do. And we know it's going to grow. So the message to folks in the community is we likely have more cases ahead. And the focus now needs to be to drive down transmission as much as possible, for as long as possible, before we get into what might be another surge, because the more we drive it down now, the better we're going to be set up to weather an additional surge if it comes.
Thank you, Dr. Cantor. And to underscore the importance of getting your vaccination, even after you've had COVID, I've got my Secretary of Department of Transportation and Development here today to get his first vaccination dose. And he was one of the very first people in the state to be positive for COVID-19. We're going to end the press conference now because I believe they started drawing doses over there, and I don't want to have any problems getting my vaccine. I don't want to have any reason to delay it or, heaven forbid, any wastage or anything like that. Thank you all for continuing to cover this. It is incredibly important that we accurately communicate with the people of Louisiana and that they get their information from reliable sources, because there's too much misinformation out there. And so I encourage everybody to get the vaccine when you can, and even before and even after, mask, distance, wash your hands, and stay home when you're sick. Thank you all, and we'll see you soon.
We'd like to invite the governor and the press to walk around this corner here.
you ever had a life-threatening allergic reaction to the vaccine? Ever had a previous adverse reaction or any personal medical experience? You consent to having your immunization information shared with someone?
Yeah.
You should have done a few curls before you.
He did. Those are the syringes and needles without the dead space, right? So you get six doses per vial. I noticed you do have some pelican socks today.
This is my NPR socks, that's right.
But they're pelicans,
Yep,
though.
yep.
Not New Orleans pelicans.
Who knew your socks were going to get judged?
I know. Well, I come to press conferences.
Right. Are you?
Go ahead.
Don't flinch.
See, the mask is helpful. I don't know whether I was like nervous or...
Governor, does the vaccine hurt?
Not any more than any other shot I've ever gotten. Thank you very much, Laura. Appreciate it. And this is mine.
This is your card. You'll bring it back to your second vaccine.
But I do it right here. So you can see that?
21 days.
Yeah.
I'll write the time on here so you can have it, okay?
Thank you so much.
And your sticker.
Governor, you got the Pfizer vaccine, right?
Pfizer, yes.
I do.